Madison here, the fitness doula, and today I want to do a quick chat about SI joint pain, which is super common in pregnancy and postpartum because so much changes in your hips and your pelvis. So quick overview of where your SI joints are. Now the fancy term for the SI joint is the sacroiliac joint, and those are going to be located on either side of your sacrum or going into the tailbone area. So they're about right here. You can probably feel a little divot there on either side. So, this is why you may be feeling the SI joint or the lower back pain on one side or the other. This is really common with SI joint pain, which is why I like to prioritize single leg movement with my clients with SI joint pain. And that's because a lot of our daily tasks are single leg movements. Walking, which sometimes flares up SI joint pain, getting in and out of the car, going upstairs. This is why we want to practice these things in a controlled environment. So I'm going to show you one exercise today that I often see click with my clients because it is a very daily task that we do that can often flare up that pain. I'm also going to give you 2 other modifications just in case that exercise doesn't quite work for you right now, because we want to meet you where you are, do pain-free movement in order to get past the pain and increase your range of motion. So here we go. I have a little step here. I have not put any risers up under this step. Usually I would start a client off with a stair or with a step with a couple of risers in it, especially for my clients who are getting in and out of taller cars like vans or big SUVs. So what you're gonna do is start standing side on to your step or stair or whatever you're using. And you're gonna take this foot closest to the step. You're gonna turn and step up. And then turn this back foot and step down. So you start facing me, you end facing the wall, then you end facing me, or the middle is towards the wall. So that is the first example of the exercise. Think about getting in and out of a car. Lots of movements that you do require this. Now, if this is causing you pain, here's where I want you to this external rotation. Internal and external rotation can be a really helpful tool in managing SI joint pain, but again, we want to meet you where you are right now. So if that movement is causing you pain, you're going to start side onto your step, and then you're just going to side step. Step up, and then step down. And you can even do this front facing the step. It's kind of up to what works for you best. So again, trying to find pain-free ranges of motion and ways that you can do these strengthening exercises, which is where I'm going with this next. For this one, you can use either a mini band or a long band like this, whichever one you have available. But I'm using this one today because often if you're finding you're having pain with that movement of stepping up, getting into and out of a mini band kind of sucks. So you're going to take this band and place it right underneath both feet. Now you can leave the handles uncrossed. I'm going to cross the handles just for example's sake and put them up to my hips. But again, you can leave them uncrossed and put them right by your sides. This will create more tension. So we're going to start off with knees slightly bent and feet under the hips. And what you're going to do from here is step to the side and then step to the other side. Again, depending on how much resistance and what kind of range of motion you have there. So lateral step, step together, lateral step, step together. Now you don't want your feet all the way together to reduce that tension. You still want to create some tension on the side butt, the side glutes. There you have it, 3 exercise examples of what I would program for a client who may be experiencing SI joint pain. Thank you so much for being here, for watching this video. If you like this content, please give it a like or comment below, and then make sure you subscribe and hit the bell.